Let's talk about treating pain with acetaminophen. Hey everyone, Steve here, paramedic instructor coordinator. Today we're going to talk about treating patients' pain with oral administration of acetaminophen. So picture this, you have a patient and you're treating their pain. You've tried position of comfort, splinting, and using cold packs, but you want to treat their pain further. In this video, we're going to unpack what acetaminophen is, what patients will be using it for, and how to calculate the proper dose. What is acetaminophen? Commonly referred to as Tylenol, acetaminophen is an antipyretic, which is a fever reducer. It is also an analgesic, or pain reliever. For EMS, we are using acetaminophen for its effects on pain relief. Unlike NSAIDs, acetaminophen doesn't affect clotting, so it's safe for our trauma patients. It also doesn't have an impact on patients' hemodynamics, so we don't need to be concerned about it lowering the patient's blood pressure. A common question is, won't this take forever? To be honest, oral administration of acetaminophen will absorb rather quickly. And when compared to IV administration, the bioavailability is almost the same. Let's talk indications. We're going to use acetaminophen for traumatic injury with pain that is not resolved from splinting, patient comfort, or cold pack. We're going to use it for non-traumatic chest, abdominal, or flank pain. However, if you're suspecting that their chest pain may be from cardiac origin, treat it with aspirin and nitro and follow the cardiac chest pain protocol. Lastly, we can use acetaminophen to treat headache, backache, and isolated, non-traumatic extremity pain. But we want to consider contacting online medical control. The reason is that these could be symptoms of an underlying cause, and we want a little bit of assistance with ruling out things like possibly a stroke. Contraindications are going to include anyone who has taken acetaminophen in the last 4 hours. Also, anyone who has a severe history of liver disease, and they might present with jaundice or ascites. Also, patients who are unable to take anything by mouth, such as patients who have excessive vomiting, or have the potential for choking, or altered mental status. Alright, let's talk dose. This is going to be for patients that are older than 5, and also weigh more than 20 pounds. This will also be a weight-based dose, so we're going to need to divide their pounds by 2.2 to get kilograms. Acetaminophen comes in chewable tablet form and is supplied as either a 160 milligram tablet or an 80 milligram tablet, which is why you'll see that the dose is rounded to the nearest 40 milligrams or 80 milligrams. The dose of acetaminophen is 10 milligrams per kilogram to 15 milligrams per kilogram, rounded to the nearest 40 milligram or 80 milligram, with a max dose of 1,000 milligrams. To figure out how many tablets we need to give our patient, we're going to take our desired dose and multiply that by the patient's weight in kilograms. We're then going to divide that number by the medication weight and then multiply that by 1 tablet. I know it's multiplying by 1, but that helps me stay on track that I'm giving patients tablets. The result will be how many tablets we need to give our patient. You'll notice though, a lot of times we're going to get a decimal point. For instance, you may end up with an answer that is 2.25. This is when we're wanting to round to the nearest 40 milligram or 80 milligrams. And this is going to be dependent on what size tablet we're using. If we're using a 160 milligram tablet, we're going to want to round to 80 milligrams because we can't split our tablets into quarters. If our tablet comes in 80 milligrams, we're going to round to the nearest 40. Let's go over a few examples on how to do the math.
Alright, for our first example, we have a 45-pound patient, and we'll be using the 10 milligrams per kilogram dosing. I like this one because it makes the math a little bit easier. Our supplied dose is a 160 milligram tablet, and our equation is over here on the right. Alright, so let's start out with our patient weight. We'll take 45 pounds and divide it by 2.2. This will give us our patient weight in kilograms, which is 20.46. We're going to take our patient weight, which is 20.46 kilograms, multiply that by 10 milligrams, and divide it by 160 milligrams, or our medication weight. So this is going to give us 204.6 over 160, which will equal 1.27. We want to round to the nearest half or whole tablet. So for this case, I'm going to round up to 1.5 tablets. So for our next example, we have a 175-pound patient, and we're going to be using an 80 milligram tablet this time. So why don't you go ahead and try it? I'll give you a minute, and then we'll go over the problem together. So we'll start out with our patient weight. We'll take 175 pounds divided by 2.2. This is going to give us 79.5 kilograms. We'll take the 79.5 kilograms, multiply that by 10 milligrams, or our desired dose, and we'll divide that by 80 milligrams. This will give us 795 over 80. We'll divide that, which equals 9.93. I'm going to round this up to the nearest half or whole tablet, so this will give me 10 tablets. Alright, one last example. You guys try it out for a minute, and then we'll do it together. So for this problem, we have a 235-pound patient, and our tablet's going to be supplied as 160 milligrams. So let's start out with our patient weight. We'll take 235 pounds divided by 2.2, and this is going to give us 106.8 kilograms. We'll take 106.8 kilograms and multiply that by 10 milligrams, and we'll divide this over 160 milligram tablet. This will give us a desired dose of 1,068 milligrams. Now, if you remember, our max dose is 1,000 milligrams. So this is too much to give. This would be an overdose.
To administer acetaminophen, we're going to take the tablets out of the blister pack and give our patient the amount of whole and half tablets they need. To split a tablet in half, we can do it along the score line that's on the top of the tablet. We'll then give the patient the tablets so that they can chew them up. Thank you guys for joining me, and if you have any questions, please reach out.